John, Senator Rich Draheim here. I'd like to call to order the Housing Finance and Policy Committee. Today is January 14th at 1:04 p.m. Today, I'd like to kind of extend a little bit of what we started last meeting, and kind of the homeless, what I call housing instability topic, and kind of start to unpack that a little bit as a portion of the puzzle of housing in Minnesota. We have received a lot of funds from the federal government on the COVID response, and a lot of it's been spent, I think, what they refer to as isolation units. But I'd like to dig into that a little bit, what resources we have out there as a state, and how do we handle them. Couple just side notes real quick, that in the paper over the weekend, as St. Paul homeless camps cleared, tough questions emerge. That was an article that was in the paper, I think either Sunday or Monday, so you can go dig for it. And then just in the last half hour, HUD's secretary just sent out a new tool to use on a federal level to find shelter, find clothing, find food for the homeless population. It's called Find Shelter. So it's a HUD.gov website. So it'll be interesting to see how that relates to Minnesota. But that literally just came out in the last half hour. So with that, I think we'll dive right into it. And I think the first thing on the agenda is the overview of state spending, and just kind of get everybody a little bit familiar on how, as a state, we try to help this area. So I think we have Mr. Mueller on for that. Joel, is that correct?
That is correct.
Yes, Mr. Chair and members of the committee, I'm going to give a very brief overview of some of the state appropriations that deal with homelessness and homelessness programs. My list that I'm going to show is by no means exhaustive. There are other programs within the agencies that may have other programs that part of their services are serving people who are homeless or trying to prevent people from being homeless. So I just want to get that out there straight off the top. I know we'll have some other presenters that will probably mention there are other programs that are not on this list that also provide services for homelessness. And I will work with the Interagency Council on maybe putting together a more comprehensive list of programs in the spending. And once we get that completed, get that out to the committee also. But for now, I will show the one program or the sheet that was on the agenda. And again, this focuses mostly on programs at Housing Finance Agency and general fund spending for programs that they have there. It also shows up some spending at the Department of Veterans Affairs and a couple of programs at Human Services. And then a little bit of what's been going on with general obligation bonds here in the last couple sessions. Also want to note that there's a tree crew outside here today, and are currently grinding up a tree just outside of the house here. So hopefully you guys are able to hear me. Anyways, at the Housing Finance Agency, the four programs I'm highlighting here are Bridges, which is a rental assistance program for people who have mental illness. And it's basically the goal for that one is trying to keep people in rental situations and out of homelessness. We have the Housing Trust Fund, which is another sort of rental assistance program that is run by Housing Finance Agency. And this is for people who are either experienced homelessness in the past or are in the family situation that may make them be prone to homelessness. Homework Starts with Home is a newer program. Housing Finance Agency works with other agencies, including the Department of Education, and it really targets families who have students who are still in school and have mobility issues. Then we have the Family Homeless Prevention Program at the department. This is a broader program. It provides grants to counties and nonprofits who also serve homeless and who are trying to keep people out of homelessness. So it's about $28 million per year at Minnesota Housing Finance Agency. Again, they probably have other programs that also deal with trying to keep people out of homelessness. And they have like a homeless hotline and things like that. So like I said, this is not exhaustive. At the Department of Veterans Affairs, many of their programs deal with trying to keep or serve homeless veterans. Their main program, though, is called the Minnesota Assistance Council for Veterans. This is about $750,000 a year, and this money goes out to counties, etc., and to put veterans in touch with services that will keep them out of homelessness. Department of Human Services, the two programs I'm noting here is housing support, and this is formerly known as group residential housing. Housing support really pays for room and board for people with very low incomes and senior citizens and adults with disabilities. Then another one that's called housing support grants. There's a couple of different grant programs within this that they've rolled together. And it's like, there's a long-term homeless services grants, the community living grants, and some website grants and things like that. And DHS, or the interagency people later on, we'll talk about some other programs at DHS that also serve homeless families and children. But these are the two I'm highlighting here now that I was able to pick out. So total general fund that I'm tracking here is about 220 million per year of state general funds. If we count some spending in other programs in other areas, that would be higher. Under general obligation bonds, there's a couple projects that our fiscal analyst who works in bonding pointed out to me that we're funding for specific projects that deal with homeless people, people who are homeless. There was a project in Carver County and a project in St. Louis Park. And then the big one is the Dorothy Day Family Center in St. Paul. It was a $12 million bonding project. So again, these are just some of the programs that are out there. And again, I will work with the interagency council on putting together a maybe more comprehensive list of other programs and how much state spending happens under some of those other programs. So that's all I have for now.
Thank you, Mr. Mueller. And I just wanted to point out that, with the COVID funding that we did receive, what I am showing is about another $90 million this year in help from either state funds or federal funds. So we're at a little over 300 million plus in help for this housing instability area of the housing ecosystem. And if anybody wants to see the spreadsheet, let me know. I can email it to you. But I guess the question would be, how many people are we helping for this $300 million? And who's getting left out? Where are the duplications, et cetera? I see Senator Rosen has her hand up.
Yes, thank you, Mr. Chair. I would like to have a copy of that because I was just scrolling through what I could get my hands on for the Minnesota Fund, which is the $200 million that came out of our general fund for housing, and there was some in there, and then the CARES Act, the CRF, that's the federal funds. That was a 2.18 billion that came in, and would like to see how much we had spent out of there for housing and how it's been utilized. I think the Finance Committee is starting to peel apart some of that stuff right now too, and it'll be interesting to see what this new round of $3 billion what they designate it for.
Thank you, Senator Rosen, and thank you for your work on the Finance Committee. Any other questions? Senator Port.
Yeah, hi, thank you, Mr. Chair. Mr. Mueller, if this is probably in sort of that more granular breakdown, but if you have information on where like youth homelessness as the money that we're spending on that would be helpful to me. If there are particular grants that go towards that aren't necessarily the family grants or the school grants, but particular to youth homelessness. And I agree, Mr. Chair, if you could share those spreadsheets, that would be great as well.
Okay, thank you, Senator Port. And I think one of our testifiers wants to comment on this too. Mr. Grumdahl, did you have some stuff you wanted to add to the conversation?
Thank you, Chairman Draheim and members. Just very quickly, Dan, look forward to working with you just on putting together this fiscal analysis that's inclusive of the programs that it's missing right now. And I think one of the other really important dimensions of doing this kind of analysis for folks to understand is that the homeless specific component of some of these programs really represents only a portion of the program's activity. So what you're seeing on the spreadsheet here is the entire cost of the housing support program, for example. Only a small portion of that program overall is homeless specific. The other parts of the program play really other critical housing support roles, of course, but just to make sure that we're clear on scope in the information that's being shared with you. So happy to work with you, Dan. Look forward to doing that. And I can very much appreciate the challenge of putting together this kind of analysis.
So long as we have you, Mr. Grumdahl, can you answer Senator Port's question about the youth portion of this? Do you have a handle on that at all, or Mr. Mueller, either one of you?
So Chairman Draheim and members, I will just comment that that to that question, Senator Port, the funding that is youth specific is inclusive of both some programs that have eligibility tied to youth homelessness. So those are clearer and more obvious for us to be able to grab and report out. And we can certainly do that as part of our fiscal analysis of being able to show kind of where there are population specific components. The piece that makes a lot of the population specific analysis more challenging is that a program may serve, most programs do serve many populations. And so it would be a much deeper dive and a much more complicated project to try to tease apart what portion of those broader programs focus on each specific subpopulation. But we can at least take a first cut at that and see if that's helpful in terms of illuminating what dollars are going to which subpopulations.
That would be great. Thank you.
Thank you both. Thanks for the question and thanks for the help, Mr. Grumdahl. Mr. Mueller, did you have anything to add on that?
Mr. Chairman, no, I think I look forward to working with Eric and some of the other agencies and in areas where we can take a deeper dive into some of these programs. And, you know, there is a split between our programs that are trying to prevent homelessness, you know, like rental assistance programs and things like that, and those that are directly serving people who are currently homeless or, you know, about to be or coming off it or something. So we'll just have to figure out some scope here of the services we're talking about and try to get some categories for that. So, but we'll get something together.
Thank you, and I think we'll dive right into our presenters now. And I guess some of the questions that's been asked to me, you know, one is, you know, what kind of numbers are we looking at? We have a population of what, 5.6, 5.7 million people. How many people are, like Senator Port mentioned, in the youth area? You know, do we have any numbers on location, age? I remember there was a survey done a couple years ago by one of the foundations, and I thought they had said that we had about 10,000 people that they counted in that one night, and I believe it was a summer night. So if any of the presenters can kind of touch on that, and then maybe also, you know, what's working, what isn't working would be very helpful. And Joel, how much time do they have for each presenter?
Roughly around 5 to 6 minutes for these folks, but this is all that we have left on our agenda, so they have some latitude here for time. Okay, so we'll start off. Thank you, Joel. I think first we have the Director of Public Policy for the Coalition of the Homeless. If he's available.
Yes, Senator Draheim, I am available. Hello, Chair Draheim and members of the committee. My name is Zach Eichten. I'm the new Director of Public Policy for the Minnesota Coalition for the Homeless. Thanks for having us in this committee. I just took this role in November, and also in November, I was elected to be one of the policy co-chairs for the Homes for All Coalition as well. So I'm serving in that role in addition to Director of Public Policy. Wanted to just thank you for having a full hearing on homelessness in Minnesota so early in session. I'm lucky to be testifying from my apartment in Minneapolis instead of having to worry today about being outside in a Minnesota snowfall during a still ongoing pandemic. And unfortunately, many of our unsheltered Minnesotan neighbors don't have that same reality. I just want to ground ourselves in that as we have this hearing today on homelessness. So that's me. I just wanted to introduce Rhonda Otteson, the Executive Director of the Minnesota Coalition for the Homeless, to give all of you an overview on homelessness in Minnesota. And I will hand it over to Rhonda now.
Thank you.
Thank you, Chair Draheim and members of the committee. I'm going to go ahead and screen share a presentation that I have. Can you see that, Mr. Chair?
Yes, we can. Thank you.
Great. I'll get started then. Well, good afternoon, and thank you so much for hearing testimony today on homelessness in Minnesota. I am coming to you from my home in Willmar, Minnesota. The Minnesota Coalition for the Homeless is a statewide advocacy organization comprised of about 100 member organizations. As a statewide coalition, we work to generate policies, community support, and local resources for housing and services to end homelessness in Minnesota. MCH is a partner organization within the Homes for All Coalition, joining over 270 endorsing organizations from across the state that work together to advocate for solutions that span the housing continuum from homelessness to homeownership. Today, I'll share some key information about homelessness in Minnesota. On any given night, there are about 20,000 children, adults, and seniors experiencing homelessness in Minnesota, and that is according to the 2018 Wilder Homeless Study, which occurs every 3 years in October. We know that 80 of 87 counties in Minnesota lack enough shelter beds to meet the need. And for people on the coordinated entry waiting list, 12 months is the typical wait time to get into stable housing. Homelessness disproportionately impacts people of color and indigenous populations, who are 10 times more likely to experience homelessness than white Minnesotans. And unsheltered homelessness across the state increased 62% between the 2015 and the 2018 Wilder studies. And finally, to Senator Port's question about, and Senator Draheim's question about how many people who are experiencing homelessness are actually youth and children, and that's almost half of the homeless population at 46%. Winter is upon us. With a lack of safe shelter beds across the state, individuals and families are forced to make life-saving decisions about how they will stay safe and warm on cold nights, amidst the reality that their choice must also protect them during this pandemic. The growing number of adults and families living in encampments has been very visible in the metro area. However, homelessness exists all across Minnesota, and though it may look different and be less visible and concentrated. Here are some examples of the ways people experiencing homelessness are trying to survive, and this is directly from our member organizations and from people experiencing homelessness. Staying in storage sheds, walking around 24-hour businesses to stay warm, living in a vehicle or an unheated garage, locking themselves in a bathroom of a business overnight to stay warm, sleeping at their work and leaving before the office opens so no one finds out, staying in tents regardless of the weather, staying in a fish house or a pickup camper in someone's yard, and finally, digging a hole into a riverbank for shelter. I would encourage you to learn even more by listening to our regional interview project Advancing policy solutions means that we turn to experts from around the state, and we really see our experts as those key organizations serving people experiencing homelessness and those who are experiencing homelessness. MCH has conducted interviews with regional experts to provide more in-depth understanding and perspectives from all across the state. If you'd like to view those interviews, they are available on the Minnesota Coalition for the Homeless YouTube channel, and I've put the link here if you would like to listen to those. In Minnesota, we have a significant shortage of housing. In fact, according to Minnesota Housing, we currently lack about 53,000 units of housing to meet the needs of all Minnesotans. And there is also a mismatch between the housing that is available and what is affordable to the lowest income individuals and families across Minnesota. So not only do we have a supply shortage, we lack the shelter capacity to bring children, families, and adults inside while they wait for a permanent home. We know that shelter saves lives and housing ends homelessness. That's why MCH, along with our Homes for All and our partners, are advancing policy solutions this legislative session that will prevent and work to end homelessness in Minnesota. In addition to endorsing the full Homes for All agenda, which is available on the website listed on the slide, I want to talk about 3 key priorities that we see as really important to addressing homelessness and preventing homelessness. First is that we need to invest in the expansion and preservation of emergency shelter beds to provide immediate and temporary housing for our most vulnerable Minnesotans. Emergency shelter beds generate a short-term solution for individuals and families sleeping outside. Second, shelters need increased funding. The base funding of the Emergency Services Program, which empowers communities across the state to find creative, flexible solutions, needs significant increases to respond to the growing needs that we are seeing. And third, we're advocating for increases to the Housing Support Program, which was previously mentioned. That program exists to prevent homelessness and help people obtain housing stability. It helps to pay for housing costs for adults with disabilities and seniors who have very low incomes. Right now, more than 4,300 individuals currently receive housing support in community settings across the state, and that number is increasing. We can strengthen this program to benefit more residents and landlords across the state by increasing the base rate funding and waiving the temporary absence requirements for individuals in need of healthcare treatment. For too long, Minnesota has neglected to fund our emergency shelter system. We are now at crisis levels of people experiencing homelessness with unprecedented increases to the unsheltered population. Again, shelter saves lives and housing ends homelessness. As we move through the 2021 legislative session, I encourage you to prioritize shelter and housing to prevent and address homelessness. Thank you, Mr. Chair and members.
Thank you. Senator Rosen, I know you had your hand up before and I missed it. Did you have anything to add to the conversation?
Well, at some point, Mr. Chair, thank you. I was going to ask some questions about the federal funds coming in and the new temporary homeless shelters that are in place. Are those going to be continuing on after the pandemic is over? What's the expectations from those? And just a general question about, you know, what it's going to look like after the pandemic is over, especially in this area. And also, I just want to recognize that this has been a very bipartisan issue. Senator Scott Dibble's worked very hard on it. Many of us have worked very hard on this issue across the aisles. So it's something that's real and it's in our face, and hopefully there's continued support from the federal government to sustain some of these shelters too.
Thank you, Senator Rosen, and I think that's what we're here to find out, is start to unpack this a little bit. And I believe a lot of the federal money that came in for COVID are for what they refer to as isolation units. And that's a lot of the hotels and motels that we've been renting, I believe. But we'll continue on, and if anybody has anything to add on that, please add to the conversation. Any other question, members? Well, thank you, the Coalition for the Homeless. I appreciate your presentation, and I think we'll move on to the next presenter. Stepping Stone Emergency Housing, I believe, is next.
Yes, Senator Draheim, this is Zach with the Minnesota Coalition for the Homeless. Once again, I just wanted to introduce Stepping Stone here. The advocate that we have speaking from Stepping Stone Emergency Housing is Delisha McCain, a life skills advocate and provider with Stepping Stone in Anoka. Delisha was kind enough to volunteer to share her story and perspective with the committee, and I will hand it over to her. Thank you.
Thanks, Zach.
Hello. Thank you, Mr. Chairman and committee, for having me share my story. I was able to talk to a representative on, I believe, Monday it was, to share my story. I'm not used to talking to a lot of people, so
You're doing great.
Forgive me. But my name is Delisha, and I work at Stepping Stone Emergency Housing. I'm the life skills person there. I became homeless. Well, I call it misplaced before I became actually homeless, but I became misplaced, my mother and I, when I was about 18. So back in 2013, we kind of were moving from house to house. My father passed away back in 2004. So it was just me and her. So, and the money issues kind of became a problem, and we couldn't afford to live in our apartment anymore. So we had to move from house to house to different relatives or friends and things like that. My older brothers actually lived in California, so they invited us to come out to San Diego and live with them. So that's what we did. And then, unfortunately, in 2014, I lost my oldest brother. And so we decided to come back here because the majority of our family is here. So we decided to come back here, and then again, we became misplaced. And then in the beginning of 2018, we kind of didn't have anywhere else to go. So we became actually homeless. I had my daughter, my daughter then, she was 1 year old, and we were living in my car in South Minneapolis. So we were living in my car for 3 months. And then we found somebody who opened their church to us to sleep on chairs, just to be able to get inside. It wasn't cold months, so that was the good part. It was in October, August, September, and October, we were homeless for. We did try to go to a shelter. It didn't pan out for us because of the lack of assistance that we didn't get. So we just kind of decided to kind of struggle on our own to figure it out and to be able to get a place. I live out in Coon Rapids, and we've been here ever since. We moved in October of 2018. In 2019, I was able to get a job at Stepping Stone as just a regular shelter advocate. And then in September, or I'm sorry, that's the wrong one. In June of 2019, I became the shelter, 2020, I became the shelter advocate. And then in September, I became the life skills advocate. And to see every day how the residents go on every day. It's not the same as me, but we have one thing in common, which is being homeless. And the things that, that the most concerns that we have or that I see is chemical deficiencies, mental health problems, transportation problems, and a lot of the problems are with youth. Right now, we have a lot of people who are 23 and younger at our shelter. And we also have a lot of adults who have mental issues. And to Rhonda, her slides actually opened my eyes, because a lot of the times you don't know somebody is homeless. Because in 2014, I started working at the airport, and my mom was actually sleeping inside of the airport as I was working, because we had nowhere else to go. And so a lot of people don't know that somebody's struggling. You could be working, you could be having a smile on your face, but you're still struggling. And to be able to share my story, and to even share my story with some of the residents at the shelter, it gives them that comfortable factor of somebody actually understands what I'm going through, instead of sometimes they might throw in your face, well, you don't really understand, this is hard. And I'm like, no, I really get you. I understand you. I've been there before. And so to be able to have, more mental health workers come inside the shelters, or on Zoom, or more chemical therapists to help people that, is struggling to get off of drugs, would be a benefactor to help all shelters, not just Stepping Stone, but all shelters. I didn't have those issues. The issues that I had was trying to find my way to get access to different fundings for myself, as far as like SNAP benefits, or just benefits that the state helps with. And so a lot of those issues that I see with residents at the shelter is starting. Where do I start? How do I start to get? Who do I go to? Like, what is the start for me is to try to get my life together. Like, I don't know where to start. So a lot of that issue is a lot that resonates with a lot of residents, and it resonated with me. And so my story has really touched people, and it makes me happy, because I usually keep it to myself. I don't usually tell people. And it wasn't until I got the opportunity to talk about it that I was able to actually fully share. And so it just to know that my story resonates with people, it makes me happy and blessed to be able to share it. So I appreciate you guys letting me come on and share it. I know it was just a little snippet of it, but so I appreciate it. Thank you.
Thank you, Ms. McCain, and appreciate your work in this area and your perspective. I think most of us here on this committee, haven't been real close to where you were, and it really helps ground us a little bit to hear stories like you, and then you passing it on to others. So I really appreciate that. Members, do we have any questions? If not, we'll move on. Once again, I really appreciate you coming on and sharing your story, and keep up the good work. Next, we have, I think, Ms. Underwood, Vice President of Social Justice Advocates and Engagement for Twin Cities Catholic Charities.
Hi, thank you so much, Mr. Chair and members. It's so great to see you and be with you today. For the record, I am Wendy Underwood with Catholic Charities of St. Paul and Minneapolis. And I'm thrilled for you to have this committee. As you may know, Catholic Charities is a housing, emergency shelter, and a direct services provider supporting over 23,000 women, men, children, and families across 18 sites. Our full directory of programs is included in your committee packets for reference. Similar to Chair Draheim, we have a strategic focus on achieving housing stability outcomes for those most in need. And I really appreciate the opportunity to share with you our work today in that space. I know today's focus is on homelessness. Recognizing your overall work as a committee, I do want to share that we operate over 900 apartments across the Twin Cities. many of them built with your support for housing infrastructure bonds. Thank you. I will say that support for operating those sites is something I'd love to come back and talk with you about another day. The majority of our renters are recipients of housing support, which Mr. Mueller and Ms. Otteson both mentioned earlier, and I'm more than happy to talk about. I want to add that it's important to know that private landlords can and do accept housing support for a person's rent. It's not just service providers like us. It can be used for any apartment or housing location. Housing support is a direct link between this committee's commitment to improving access to housing affordability, and to ending homelessness. So I'm really glad you're learning more about it. As you build this committee, I ask you to think about the full housing continuum and the role emergency shelters play. I really believe shelters are misunderstood. Shelters can provide an incredible opportunity for a person if we as a state recognize shelters as being a part of our full housing effort, as well as a front line to our healthcare system. Because that's what we do. When a person comes to us in need, shelters provide a safe space to sleep, a warm meal, and an opportunity to find a more stable place to stay, and oftentimes the health care that person needs. When we think about our housing and homelessness crisis in Minnesota, obviously most recently we focus on the immediacy of COVID-19, but it's important to remember that we were experiencing this crisis before the pandemic. In the 2 years prior to COVID, my organization experienced a 32% increase in clients seeking our services. 1 in 5 of those are people over the age of 55. Many of you have visited our Dorothy Day campus, just blocks from the Capitol, and many of you supported the critical state funding to complete that project, and we are so grateful for that. I am able to take individuals around the campus in a safe way during the pandemic, but of course, we'd love to have you back when we are past this time. Before COVID, our shelter on that campus was at an absolute max capacity. It was sheltering 356 guests every single night, which was up from 280 when we first opened in 2017 and what it was really built to hold. The Opportunity Center on that campus is where meals are served, healthcare is provided, and case managers are there to work with people experiencing homelessness to help find housing and services. Many assume that this is a publicly funded operation, but the reality is that private funders, foundations, and frankly, critical reserves are paying for more than 90% of expenses, which blows my mind every time. And it goes without saying it's not sustainable. And it also means that we are often not able to do enough. And I'm speaking from Catholic Charities, but I think I say that on behalf of most, if not all, shelter providers. The pandemic then has put an even greater strain and demand on our services. I am excited to share with you this story during these really challenging times. Our team has had to constantly pivot and innovate to ensure that we could continue to serve our clients safely. With our tremendously skilled staff and frankly some luck, we've succeeded in doing this without interruption or a single day of closure. We have not closed our doors the whole time. And in fact, in several cases, we've expanded our hours to ensure people in need still have a place to go. Our frontline staff have worked tirelessly through it all. We fully revamped our food service. We've implemented new hygiene and social distancing protocols. We've worked closely with county partners to decrease the census at our shelters and to move guests into safe alternatives. You name it, we've tackled it. These staff have gone even further to prove themselves as a critical part of the healthcare system too. At Catholic Charities, our staff screen more than 1,600 adults and children each and every day across our sites, screening them for symptoms of COVID. Our staff are also frequently the first point of referral for those needing additional help for COVID. These same staff have played a critical role in contact tracing and coordinating testing events to prevent community spread. They literally stand alongside registered nurses to assist with intake and registration at every testing event at our sites. I have even done this, and we have been all hands on deck, and I have absolutely staffed testing events and different needs through COVID. It is truly the front line. More than ever before, this pandemic has shown that emergency shelters must be recognized as critical community infrastructure, just like our hospitals and emergency rooms. Shelters can't suspend services or work off-site. They are a part of our state safety net, and if they fail, our healthcare system will not be able to manage the additional pressures. As I mentioned earlier, we cannot do this work without public support. Mr. Mueller didn't mention this, but the Emergency Services Program is the state's only investment to help Minnesota shelter providers respond to homelessness. It's operating support. These very flexible dollars help support food, bedding, laundry, housing and employment counselors, hotel vouchers, and more. During the pandemic, both state and federal emergency relief, for which we are extremely grateful, has been funneled through the Emergency Services Program to help providers cover increased costs. It's been incredible. The team has done an amazing job. These investments—
Miss Underwood, I'm sorry to interrupt. That fund that you're referring to wasn't on Mr. Mueller's list, right?
Correct. Ms. Augustin would mention it, but yeah, it's because it's an operating fund.
Okay.
But
And that comes out of Senator Abler's committee then, and Senator Benson's?
It does, yeah.
Okay,
it does.
And it's called Emergency Services?
Program, yep, ESP. Okay. Yeah.
Okay, and do you know how much is set aside for that good program?
Yeah, the funding for that is, I believe, just over $800,000 a year for statewide to support shelter operations statewide. And so in the last couple of years, the legislature has supported small one-time increases to be able to help address the growing homelessness crisis, but we are advocating for $15 million of biennium in base, stable, ongoing funding.
Okay, thank you. Sorry to interrupt.
No, not at all. That just about wraps it up. Okay. Actually, I super appreciate the question, because just to wrap it kind of back up into what I'm driving at with the role of housing and your committee work and homelessness is that our shelters and the housing support we've talked about, they do save and strengthen lives by providing pathways to stability. And the need for this won't go away when the pandemic ends, which is important to remember. And so I really appreciate supporting your work in building this connectivity. And I just ask you to take this session as an opportunity to really invest in this space. And we really look forward to continuing the conversation. Thank you so much.
Yeah, thank you. Thank you for your testimony. And before I go to Senator Dietzich, I thank you for your work, and any information you think the committee should know, please pass it on to us, and that would go to any of the presenters. We're trying to get our heads wrapped around this a little bit with this new committee. But I'll go to Senator Dietzich. Do you have a question?
Yep, thank you. I'm sorry I was late. I thought I would be a little quicker getting home before the committee started, but that didn't happen. But thank you, Ms. Underwood, for testifying. I also want to thank Ms. McCain for testifying. I think it was very helpful to hear what she had to say. And so I look forward to hearing more from the people who are using the system or who have been in the system, just to figure out what barriers and how do we get around those barriers. I have two kind of quick questions, maybe three for Ms. Underwood. Did I hear you correctly? It was that the ESP was 800,000 per year?
Yes.
Okay.
Yes, Mr. Chair, members, yes.
And you're looking for 15 million?
For the biennium, yes.
Okay. Okay.
Yep. And that's a position that Homes for All has had for the last few years.
And then, so a few years back, I was talking to St. Stephen's, and it wasn't that long ago, and, you know, was asking them about, again, the need for shelters and different type of shelters. And their comment was, we don't need shelters as much as we need housing in that 15 to 30 to 50% AMI. So I'm wondering if, I mean, clearly we need shelters or we need something, because I had people living in 3 parks within walking distance from me this summer. And so just kind of wondering that. And then to you and then to the others, I don't need an answer today, but to just keep thinking about what are the barriers that we're keeping people from getting into shelter and then getting into housing. So again, I kept hearing this summer we had shelter space, but I got people living in parks. So we're just kind of thinking about how do we break down those barriers and what's the best way to, again, we want to get people into shelter and then into permanent stable housing. Thanks.
Yeah, sure. No, I really appreciate the question. I will say regarding most immediately with this summer and the unsheltered communities and access to shelters, you know, a lot of great effort has gone into supporting as many people as possible, as safe as possible. I would imagine that the Interagency Council was going to speak a little bit more to that. Before COVID, being able to get a place to stay in a shelter was hard because of just the max capacities we were experiencing. That for Catholic Charities, that is the only barrier, is just literally if we cannot make room for one more person, or if we're not legally allowed to. I will say regarding, you know, and then the barriers to housing, and then the need for more housing, absolutely. And the barriers, are becoming more and more, just real common things that any one of us can experience. The rents are too high, and the availability too low, and you have one slip, you lose that extra part-time job, your car breaks down, your child needs surgery. You prioritize your bills, and you can't afford the rent, and things happen. It happens every day around us. And that's becoming more and more commonplace. And then those deeply affordable rental units that you described, yes, those are critical in both preventing homelessness, so that there are places that people can continue to afford as they are getting back into stability. And then once a person has experienced homelessness and is in that space and is able to get the services, the healthcare, the supports that they need to then be able to move into an independent apartment. Again, they need it to be as deeply affordable as possible, because chances are the person isn't in, some big new job and have all of these things and an influx of finances. So it really helps prevent homelessness, and then it helps when people pulling themselves out. And then that moment in shelter should be as brief and temporary and one time as possible. That should always be the goal. And in that moment, us really providing that the help that we can when they're with us, and so that there's just as short as possible. And that's not what's happening right now.
Thank you, Ms. Underwood, and thank you, Senator Dietzich, for the question. Do you have any follow-up on that? Senator Dietzich, you're good? Okay, thank you. I think your testimony and the work that you do and the others do, to me, what can we do to prevent people coming to see you guys? Yep. is where I think the state should be at. And, and that's why I'm fighting so hard on the other end of the spectrum to get more affordable housing, so people can find an affordable option. But then on the other end, there's the mental health and drug treatment that is needed, and what can we do? And then, looking at how we reacted to the pandemic, playing a kind of a Monday morning quarterback, what could we have done different? Those are things that I ask all the groups that are on here today to think about, so we can learn from that as a state agency and or as a state, and pass it on to the agencies, because there's always things we could have, would have, should have done different on any situation. But with that, if you are done, we'll move on to the next one to keep going on our timeline. So thanks again, Ms. Underwood. I think next we have Minnesota Interagency Council on Homelessness. So I believe someone's on for that.
Yes, hello, Chairman Draheim. Thank you so much. Thank you for having this hearing, having this topic at this hearing. Very, very grateful for the opportunity to share the work of our statewide partnership. I think we are really fortunate in Minnesota to have such strong partnerships between our government entities and our nonprofit and service providers all across the state. And so really honored to be on here with the previous speakers who are really good examples of some of those excellent partners. I am Kathy Tenbrook. I am the Executive Director of our state's Interagency Council on Homelessness, and I am joined today by a couple of my team members, Deputy Director of the Council, Eric Drumdahl, and our Implementation Specialist, Elizabeth Dressel. We know our time is short, and our goal is to give you a high-level overview of the work on homelessness throughout Minnesota, and to touch specifically, at least briefly right now, on the work that's been done during COVID-19 to protect people experiencing homelessness from the worst outcomes. And most importantly, we just really want you to know we are a resource here for you. I'm not sure how familiar all of you are with the Interagency Council, and so I'm really glad to have the opportunity to make sure you're aware of us, and that we're here to help you with whatever more information you might need as you go forward. Next slide, please. So you may or may not be familiar, as I mentioned, with the council, but since 2013 in Minnesota, we have had a cabinet level interagency council on homelessness. It is currently led by our Lieutenant Governor. It is co-chaired by our Housing Commissioner and our Human Services Commissioner, and it has the commissioners of all of these agencies you see here on the slide. It was established really with the recognition that no one entity and no one state agency certainly has all that is needed to prevent and end homelessness, but that each agency has a role to play. Some of these agencies on here operate some of those homeless specific programs we've been talking about, that we talked about at the very beginning, maybe at Minnesota Housing, of course, like family homeless prevention assistance programs. At DHS, we were just talking about the emergency services program. They also have the Homeless Youth Act dollars. But others on this interagency council may not operate homeless specific programs, but they have very critical mainstream resources and systems that are so important to preventing people from falling into homelessness. And once people do end their homelessness, helping them remain stable. So, like the employment programs and health programs, transportation, and things like emergency assistance. So there's a lot of work that is done with these agencies to coordinate across these various systems and make sure that we are really building the kind of stability for Minnesotans that we need to prevent and end homelessness. And all of this is also done with the recognition that while putting programs in place to prevent and end homelessness does cost money, we know from years of work that homelessness itself is very, very costly on our public systems. If people fall into homelessness, they often do cycle through multiple systems. People who are sleeping outside, as we witnessed, of course, we've been witnessing for years and very visible this summer, will enter emergency rooms at higher rates and enter these expensive systems. When we break that cycle, we can break those costs as well. But there are also some very tremendous real costs to homelessness, like the lack of opportunity for young people and certainly for children who fall into homelessness. The impact on their educational outcomes is very, very clear. Next slide, please. So what you see on this slide are the series of statewide plans that have been created in partnership with everyone around the state, some of the folks who were just speaking a minute ago, and many, many others, to really guide our work collectively on what it will take to do to create housing stability for all Minnesotans. I want to note, however, that Minnesota, and I can't remember who mentioned it, one of you mentioned this earlier, which I think is really important. Minnesota has a very strong history of bipartisan support and leadership on this issue. During Governor Palente's term, he launched a plan focused on chronic homelessness and creating the kinds of housing opportunities for people who had been homeless the longest and also had some very important health issues, chronic health issues, mental health issues, et cetera. And that housing that was created through that plan, it was about 3,000 housing opportunities of what we call permanent supportive housing. So housing that's affordable and then linked to the kinds of services and supports people need. These plans have really built on that and have just moved from focusing not only on chronic homelessness, but actually building on that and focusing on youth homelessness, family and children homelessness, veteran homelessness as well. I also thought before we move on, it might be helpful for all of you to know, you keep hearing us say, plans to prevent and end homelessness, and we're going to end homelessness. And I know there's a lot of confusion about what that really means. So what does it mean when we talk about ending homelessness? And I want to assure you that those of us working on this, it's not that we think that that means that no one ever again will have a housing crisis, or that no one ever again will potentially fall into a level of housing instability that brings them into these systems and programs. But what we mean is that we have learned a great deal over the years, and we believe it is very possible to create systems that can prevent more people from falling into homelessness. And if they do fall into homelessness, to really make sure we catch them quickly, that their time experiencing homelessness is very, very brief, and we quickly connect them to the kinds of housing and supports that they need on the back end. And if we do that as a whole system, as a state, then that's really, in our minds, what ending homelessness looks like. I think our best example in Minnesota is the work that's been done on veteran homelessness. I know many of you know that we've had tremendous success in that area. We have 10 regions of the state that we call continuums of care. They're groups of counties that work together on their homeless response. And of 10 of those regions, 6 of them have actually been successful at creating that kind of a system for homeless veterans, where they now have everything in place they need to prevent veterans from falling into homelessness, to identify a veteran if they do become homeless very quickly, connect them to the kinds of housing and supports that they need. And they have data to...
So can we get the which regions those are?
Absolutely.
You've been successful, and why do you think you've been successful in those 6 out of 10 regions?
Yes, thank you for asking that question. The reason we have been successful is because we had the tools at our disposal that we know and have been proven to work to end homelessness. So bipartisan federal support for new housing assistance for veterans. So these in the form of housing vouchers, making the housing that we have in Minnesota affordable to those veterans. And then linking those housing vouchers with the kinds of services and supports that veterans need and want to remain stably housed. And so that is something that we know works, and that is a recipe for what could work for other populations as well. So it's really been a proof point for us about the work that we can do when we have the kind of supports. I should add, though, Senator Draheim, that in addition to having the tools, I think the other really key ingredient is having really good data and really good coordination and support among partners. Because if we just have the tools, but we don't target it really strategically at the people who need it the most and who need that specific resource, we aren't going to be as successful. And I can be really honest that, years ago when Minnesota and the whole country first was receiving those opportunities for veterans, they weren't as strategically focused as they could have been. And we had to learn quickly and readjust and really make sure they were getting to veterans who, but for that resource, would remain homeless. And that's what we have then done since then. And I really credit that to a huge part of the success as well. So next slide, please. So our statewide plan that we are working on right now, the Heading Home Together plan that we have created with about 1,000 Minnesotans across the state, is really organized around these 7 principles. All of our strategies and actions are really utilizing the things that we know after doing this work for so long together in this country are really the key ingredients if we're going to end homelessness. The first thing, of course, as you've said several times, Chairman Draheim, is that we want to prevent people from falling into these systems. But if they do fall in, we really need to be better skilled at quickly identifying people. And as I mentioned, we've done this with veterans very well, but less well, I think, with other populations. So identifying everybody who's experiencing homelessness, to the speaker's points earlier, really having some form of shelter immediately available to anyone who needs it. We have not hit this mark yet, I can be very honest with you. But we know that shelters do save lives. We know that if somebody's in a shelter, it's much easier to work with them to try to connect them to the kinds of supports that they need. Linking people experiencing homelessness then with the services that will work for them, the housing and the services that will work for them. Assisting people to move quickly into that permanent housing. This next one, number 5, I think is really, really important and maybe a key to some of the things that we could do differently or not differently, but better. We certainly do this, but we need to do a lot more of it, is to use a person-centered housing first orientation to our approach. And what housing first is that we simply are saying, instead of working with somebody and saying, you know, we're going to help you get into housing, we're going to do our best, but first you need to do these 5 things to make sure that you're housing ready. It's kind of taking that and turning it on its head and saying, you know, what we have learned is that when people get into housing first and then have surrounded with them the kinds of supports they need to, you know, drink less, get sober, take medications, you know, go to school, whatever those things are, that is when we have been successful. And that's what, you know, essentially Governor Palente's plan helped us see early. And that's really what has worked to bring some of the people who've been homeless the longest inside. Sometimes we'll hear people say, well, you know, they're just not ready for housing. And I think just in my humble opinion after all these years is that I've never really met anybody who's not ready for housing, but I have realized that we have housing that's not ready for people. And so it's really making sure that the housing that we have meets the needs of people where they are. Helping people increase their employment and income is, of course, really critical for that long-term stability. And then number 7 is all about organizing our work with all of our partners across the state, all levels of government and the private sector. We have a wonderful partnership with philanthropy. We've been working with an organization called the Heading Home Minnesota Funders Collaborative and using private resources to really help do some of the things that the government is less able to do. And it's been a wonderful partnership together. Next slide, please, Eric. I'm going to turn this over to my deputy, Eric Grumdahl, now to walk through some of our data. And I know Eric can share, Chairman Draheim can share with you the locations where we've ended veteran homelessness as well.
Thank you, Kathy. Thank you, Chairman Draheim. Thank you, members. My name again is Eric Grumdahl, Deputy Director of the Minnesota Interagency Council on Homelessness. And just to come back to your question, Chairman, a moment ago, the regions of the state that have ended veteran homelessness include all of the state except for Hennepin, Ramsey, St. Louis counties, those 3 counties, and a region of counties in central Minnesota that's called the Central Minnesota Continuum of Care. But the balance of the state, the remaining parts of the state, have submitted the evidence, really the documentation, to the federal government and had federal confirmation that they had reached the goal of ending veteran homelessness. They join a community of almost now 100. They join a group of almost 100 other communities across the country that have also reached that goal. So it's a very significant and meaningful demonstration of really standing up the systems that are necessary to not only achieve that benchmark, but to sustain it over time. And so just by way of context, I think you've heard repeatedly from many of the presenters today, and to anchor it again, the relationship between the availability or lack of availability of affordable housing and homelessness. I think it's important to set the context that people experiencing homelessness are really only a small segment of the Minnesotans that are facing serious housing challenges. And so there's over 500,000 households in Minnesota that are cost burdened, meaning that they're paying more than 30% of their income toward their housing, and 30% is the threshold that is typically used for that affordability. And when we look at the lowest income renters in particular, that group is even more dramatically impacted by being cost burdened. So 4 out of 5 households that are making less than 30% of the area median income are cost burdened, and most of them are actually paying more than 50% of their income toward housing. So a very significant kind of context that this sits within. But compared to that 500,000 households, 557,000 households that are experiencing cost burdened housing, I think in that low income household group, the absence of units that are available to them, Minnesota Housing has estimated that there's just about 180,000 households in that low income group who are renters, and yet there is only 117,000 units available for those households, and 50,000 of those units are actually occupied by households that are making more than that low income threshold. And so what we see is just a really dramatic gap between the available affordable housing in Minnesota and the number of people that need it. And so in that context, then we focus in specifically on Minnesotans experiencing homelessness. And the slide that's on the screen in front of you is the annual point in time count. This is an imperfect, one of the data sources that we use, but all of them represent in some sense an underestimate, right? We're always going to miss some individuals who should be included in a count like this. This is a count that's organized at a community level, sending volunteers out to identify everybody that we possibly can on a single night in January all across the state. That same approach is used all across the country, which gives us the ability to compare Minnesota and our jurisdictions to other jurisdictions across the nation. This is only one of the data sources that we use, and I think what you'll see here is the way in which we try to use multiple data sources to illuminate different aspects of the problem and the dynamics in homelessness. And what you see here is the kind of progress that we've seen over the last decade on homelessness, and it's a mixed report.
I think you're muted, Mr. Grumdell. For some reason, you went back.
Apologies. Okay, hopefully now you can hear me. Thank you, Chairman. So what you can see is that the progress report is mixed, that we've seen some progress on the number of Minnesotans experiencing homelessness overall. So the count that occurred in January 2020, again, this is pre-pandemic, we actually are seeing, since the First Heading Home plan was launched, a 5% reduction in the number of people in Minnesota experiencing homelessness. And we've seen a really dramatic reduction in the number of people in families experiencing homelessness, down 32%. But for other populations, we've seen that those numbers have increased. And in particular, I think one of the places that has been the area of greatest focus, not just during the pandemic, really before the pandemic hit, is the increase that we've seen over the last several years in the number of Minnesotans staying outside. That fits with patterns that we've seen in other communities across the country, but I think has motivated for a number of reasons, including the immediate risks to life and safety for people when they're outside, really urgent attention and appropriate attention in trying to find solutions that work for people who are outside. The other thing that data on homelessness really lets us depict is some of the ways in which who experiences homelessness in Minnesota reflects really significant impacts of racism and racial inequality. And so this graph gives us a picture comparing the general population on the left-hand side of the graph to people in poverty, where you start to see some disparities in terms of race and ethnicity, to the homeless population, where those really explode. And so the way to read this graph is that what we understand is that the homeless population, Native Americans in the homeless population, Natives are 27 times more likely than a white Minnesotan to be homeless. The unsheltered population, we see that disparity even increases. And so for us, I think this really motivates the centrality of racial equity and addressing those racial disparities as a critical ingredient in the response to homelessness. One of the other dimensions of homelessness that we think is important for folks to take away, and it in some ways kind of defies the myths or the misperceptions maybe of who experiences homelessness in Minnesota, is the wide geographic distribution of students experiencing homelessness. This is a different data set now of the students whose schools have identified are experiencing homelessness. And as you can see, we've got schools having identified those students in 77 of Minnesota's counties. And so the dots on the map represent an individual school that is identified at least one homeless student. And I think the notion that there are 9,000 students that schools identify on a single day, this was as of October 1st of 2019, I think that would be a surprise to many Minnesotans that there are that many students experiencing homelessness, or that the distribution of those students would be as broad. We do see the same.
Can I ask a quick question on that?
Of course, Senator. Yep.
So is that K-12 schools, or is that colleges and K-12?
It's K-12. There actually are also some early childhood programs that do report data into this system, but they are not required to do so. K-12 public and charter schools are required to report this information.
Thank you.
Thank you, Mr. Chair.
And I think Senator Dietzig has a question. As long as we stopped you there, sorry about that.
Certainly.
Thank you. I have heard in the past that there are some data privacy and data sharing issues with some of these schools. So when you talk about the schools identifying those kids, are those schools then able to take that information and share it with the county or HHS to get those families help? Or do we need to work on some data privacy, data sharing issues? Because I think there were some where before they didn't want to stigmatize the kid, and so they didn't want to acknowledge that they were homeless or share that they were homeless. But I think we're missing an opportunity if we can't share that data to then make sure those families have those services and connect them with services. So is that happening in at least some of these schools?
Chairman Draheim, Senator Dietzig, thank you for the question. I think there are significant challenges for schools and other partners to be able to share information. The Homework Starts with Home initiative actually is one of the examples of a place where there's really intentional partnerships among schools and other organizations in a community that can help respond when a student is identified. But in general, I would say that where those partnerships have formed, it's because of folks that are really committed and persevere through the difficulty of trying to find a path to be able to share that information and create those partnerships. It's not a straightforward or easy thing right now. And we do believe that if there were ways to promote that kind of information sharing, while also, of course, maintaining the privacy and protection of the people whose information is being shared, that could foster faster reaction and partnership and even being able to identify students more quickly. There is, I'll also just mention very briefly, a really exciting pilot project that the Hopkins School District is participating in that is as part of a national pilot to really break down some of those barriers to identifying students earlier in their experience of homelessness, so we don't wait until there's already been significant impact. And I think there's going to be a lot learned from that, and certainly data privacy issues and data sharing has been an important barrier for that group to also struggle with and overcome.
Thank you.
My pleasure. Thank you. So then the last bit of information that I'll share before handing this off to my colleague Elizabeth Dressel is that I think the other piece that I think is important in painting the context of homelessness is really to understand the fact that people experiencing homelessness often, not always, but often are also confronting one or more other significant challenges at the same time that they're confronting housing instability. And so we think of these as really critical, complicating factors that, you know, the number of homeless adults who are also confronting serious mental health issues, substance abuse disorder, or chronic physical health conditions, or as is often the case, multiple of those at the same time. What we see from this research, which was conducted by the Wilder Research Center as part of their triennial study of homelessness, is the ways in which those issues are can often complicate and confound the path back into housing, and really need to motivate the right kind of support being provided to people who are experiencing homelessness. What we know is that there are many Minnesotans who are facing these same challenges who are not homeless. And so one of the key differences there is that is being able to have access to affordable housing, to be able to have access to the right kind of support, and to be able to financially kind of transition and remain stably housed. The other piece that this picture really helped underscore early in the pandemic response is how critically important it will be to attend to the disproportionate COVID health outcomes that we would anticipate for a population where the number of physical health conditions in particular is as extensive as is depicted here. So with that, I would be happy to hand this off to my colleague Elizabeth to talk about the COVID response.
Thank you.
Thanks so much, Eric and Chair and members. My name is Elizabeth Dressel, and I'm the Implementation Specialist with the Interagency Council on Homelessness. So we can go forward to the next slide. Just going to do a very brief overview of our state's response. Like Eric was mentioning, we realized very early on with some of that chronic health data, as well as other factors, you know, the congregate nature of many shelter settings, that there was going to need to be a very targeted and focused response for people experiencing homelessness to make sure they were protected from COVID. So that response sits within the at-risk populations work group, which was set up as part of the governor's COVID response structure, which that group is co-chaired by Kathy Tenbrook and then Dan Pollock from the Department of Human Services, and have been focusing that response. And so Eric, you can go to the next slide. And just a little bit of the summary from our work. In this pandemic, as well as in our general response to homelessness, the state's role has really been as a convener of people, consolidator of best practices and resources, especially in this case, the public health resources, and as a funder. So in this past year, our state team has worked really hard to bring people together through extensive outreach with our provider community, doing one-on-one technical assistance. We've got a number of folks from the Department of Health on our team, meeting regularly with shelters and programs that wanting to think through the complexities and making sure they were prepared to support people and make sure people were safe, creating guidance and technical assistance that was really specific to these settings, and people staying outdoors. As well as we have had weekly newsletters and webinars where people are able to get information in real time, ask questions of our state team, trying to be a resource for them. As well as there's been many resources, both state funding resources and federal funding resources that have been absolutely critical in this response work. We needed those resources. Local communities worked really hard to retool the existing structure to make sure it was working and making people safe during this pandemic. So sites have worked, as Ms. Underwood was kind of talking about, decompressing shelter spaces so people could space out and make sure they could maintain at least 6 feet of distance, moving high-risk individuals into hotel settings, or some shelters were choosing to move all of their shelters and protecting folks by moving them into hotel settings. Operating 24 hours a day, 7 days a week. That wasn't always the case in the past. And so making sure that shelters could be a space for people to stay during the daytime hours, especially early on in the pandemic when there was nothing else open for people to be able to stay inside and be safe. So these funding resources for communities and nonprofit providers like Catholic Charities and all across the state, it has been absolutely critical that they got these resources quickly and were able to stand up over 2,800 temporary shelter operations that needed, that also covered staffing, making sure they could get food to those folks. I know meals delivered to encampments, personal protective equipment, and all the things that really went into making sure that response was supporting people from COVID infections. And throughout this response, as Chair Draham, you were mentioning, we've really been trying to think about what we've been learning, and we will be continuing to do that to think about how that impacts our work moving forward. So next slide, really this rapid response. And if you want to move to the next slide for me, Eric. I'm just going to show, and maybe you all can see that on your slide. I'm still seeing the key responses slide, but the next slide is just going to walk us through what we have really felt like this rapid investment and work by communities, thanks so much, has really protected people and kept our case rates low. This graph shows case rates over time since March through last week. And in total, we've had about a little over 900 people experiencing homelessness, and the staff who support them test positive for COVID. We really thought at the beginning, looking at some epi data, that we could have cases get into the thousands very quickly based on some of the site settings. Those were worst case scenarios that we're very grateful did not happen here in Minnesota. We've been able to keep case rates low, and many of our colleagues really attribute that to that collective statewide response that was very rapid to make sure people were safe and being able to intercept cases and before they became outbreaks. But what we have seen, and what you'll see on that right side of your graph, is how quickly that can change and how quickly cases can grow. So beginning in November, we saw cases in our settings grow rapidly, and knowing how important it was having some infrastructure in place to get those back under control. We know that these resources have been part of the reason that in the amazing work by our local communities and nonprofit partners across the state to make sure people were safe. We've got to keep those protective measures in place moving forward until we're able to get everyone vaccinated, to make sure we don't see continued growth among people experiencing homelessness contracting COVID. And next slide shows, why this is even more critical. Is this talks about hospitalization data, and there's disproportionate rates among people experiencing homelessness who test positive for COVID, needing hospital and ICU level of care. So that red bar on the top of this graph is the Minnesota population generally who've contracted COVID. The blue is sheltered at the time of their diagnosis of COVID, and green is unsheltered. And as you'll see, sheltered folks were over 20%, and unsheltered, nearly half of them needed hospitalization once they contracted COVID. Unsheltered folks were 4 times more likely, and sheltered folks were 4 times more likely, and our unsheltered population was 7 times more likely to need ICU care. And so what this is really showing, these disproportionate rates are really showing is, people experiencing homelessness are at higher vulnerability for severe illness, as well as the protective measures to keep people from getting COVID are incredibly important so that we don't overburden our healthcare systems.
So if we could, we have a couple questions. Sorry to interrupt. I think first is Senator Port and then Senator Dietzig. Senator Port.
Thank you, Mr. Chair. I'm just wondering if you can give some information on if the unsheltered population has been provided with adequate testing, and how you sort of have overcome the barriers to testing this population, and also getting the results back to the person, and if that's still a needed resource that we need to address.
Kathy, I might turn that question to you, since you've been working with the team on that.
Absolutely. Thank you, Senator. I would say the testing has mostly, so in the metro area, especially in Hennepin, the local public health response, including for people outside, has been really tremendous, and the testing has gone well. I think where we've had more challenges is out in some of the smaller regions of the, smaller populated regions of the state, where the local public health system is less geared or less used to working directly with the homeless response system. And so we've had to do some really creative work with them to increase the ability for them to do testing as well. But I say by and large, local public health has really, really stepped up and done a tremendous job with folks that we work with. As we're getting ready to provide vaccine, just to maybe put even finer point on Elizabeth's comments, all of those spaces that we have stood up, if we can hold on to those as long as we possibly can, we know that those are one-time dollars, and we do have a cliff, and we will lose a lot of those spaces to, I think, Senator Rosen's question earlier. But as long as possible, because we will then be able to keep track of people and provide the vaccine directly to those individuals in a much more effective way.
Thank you. And can I follow up with one more?
Of course, Senator Port.
Thank you, Mr. Chair, and Ms. Tenbrook. Do you have like the date, like an end date where you know you're going to run out of that money, and how much more you're going to need at that point to keep those facilities running?
So I think, as most of you know, at the end of the year, we were really concerned. That was our first cliff we were facing for those 2,800 spaces stood up across the state, because they were mostly funded with the CRF dollars, the federal dollars that went away. We're very grateful for the Minnesota COVID fund dollars that we received at the very end of the year to help bridge that gap for at least a few more months. We believe, based on the data, that we will be able to hold on to those through the end of March. So not an exact date, Senator Port, but somewhere in that range is our goal. We will then face a cliff then as well.
Thank you, Mr. Chair and Ms. Tenberg.
Okay, thank you. Senator Dietzig, we have just a couple minutes left. Thank you.
Yep, thank you. And mine might not be a question as much as just to consider thinking more about. So in the unsheltered here that end up in the hospitalized and ICU, so you know, when you go to the hospital, they usually send you home with a bunch of checklists of things to do. And I know my brother got sent home with still like tubes in his body. So, you know, what do the people do when they're homeless? And so I know like Catholic Charities has medical respite, but how much of that unsheltered that ended up in the hospital or ICU, you know, where do they go when they're discharged? And then do they end up just cycling back into the emergency room? Because you know, how do you monitor all of that and take care of yourself when you're living on the streets?
Senator Dietzig, just a quick, I know it's more of a very important comment than a question, but I think you're hitting on something that's very, very challenging. I will say, of course, if anyone was still COVID infectious with COVID, we had a very effective way of getting folks into isolation spaces, and that's been one piece of the way those dollars have been utilized in order to protect the community at large and the rest of them, of course, as well, and monitor their symptoms. But once they're clear, you know, our isolation hotels are not shelters. They are isolation hotels meant to serve people while they're infectious. And then they are back to wherever they were before they came to the hotel. It could be outside, it could be in a shelter. I will say, to the credit of so many of our partners across the state, and to credit, you know, to weave some of the federal dollars we had to respond with some of our programming, like our housing support program, which has been mentioned a couple of times. We've been able to really try to focus on housing solutions for people while they were in hotels. So in many cases, you know, not just saying, you know, good luck, your time's up, but really working with some other dollars, trying to be strategic and weave them together to really try to end people's homelessness at the same time. Those federal dollars were COVID specific and really only focused at COVID response, but we tried to bring in some of our state homeless dollars where we could to see if we could also really better serve people.
Thank you, everyone. And if we could get the numbers for the COVID from the Minnesota Interagency Council on Homelessness, what was spent during COVID. Senator Rosen had asked for that data. I'll send her what I have, but I know it's just a snapshot. And I guess I think the other thing, there was one other thing, I'm sorry. The map on the veterans areas. It'd be nice to know the different regions on those 10 different areas that were mentioned. So if we could get that as a follow-up too, that would be greatly appreciated. And go ahead.
Sorry, as part of that map, if it also has like numbers associated, that would be helpful too. So like, you know, what are we talking about? You know, what is that? The number still in Hennepin, Ramsey, and St. Louis County. So numbers would be helpful too. Thanks.
Wonderful. Thank you, Senator Dietzig. And with that, members, we're 2 minutes over. I appreciate everybody's time, and we will see you next week. Thank you. We are adjourned.